Talking about macular degeneration, the leading cause of blindness in people over 65.
Here you can see that
this retinal surgeon led a study looking at whether newer diabetes drugs like Ozempic and Mounjaro might increase the risk of certain eye diseases. The findings?
There was a risk that was twice as high of developing this wet macular degeneration in patients who are on the GLP-1 receptor agonist compared to those diabetic patients who are not.
Double the risk, but the study puts that number in perspective. Researchers in Ontario examined the health records of nearly 140,000 older adults with diabetes. They found, among those taking newer GLP-1 drugs, the risk of developing neovascular age-related macular degeneration was 2 in 1,000. For non-GLP-1 users, it was 1 in 1,000. A small risk, but the research can be meaningful.
Now, there's many times when there's these wonder drugs that come out, and sometimes we find other effects that weren't anticipated.
Doctors all agree the health benefits of GLP-1 drugs for obesity and diabetes patients outweigh the risks.
These medicines are powerful and very, very effective tools, but any tool used incorrectly or badly with inappropriate care can cause harm.
Nobody wants to have their vision affected.
Rick Rangelbraun uses Ozempic to manage his diabetes.
Every medication, there's side effects, and you have to be careful and watch for them, and then bring them to the attention of your doctor.
While the risk is small, some doctors say they may now think twice about prescribing GLP-1s to diabetes patients with pre-existing eye disease, or advise them beforehand. If there's any change in your vision, get checked immediately. Christine Burak, CBC News, Toronto.
Now it's time to dig deeper into the stories shaping our world. The global